250 million obese people in India by the year 2050. 40% of women and 12% of men have abdominal obesity. Weight loss drugs enter Indian market. Mounjaro, Ozempic take the world by storm. Anti-obesity drug market crosses 576 crores in 2025. Are weight loss drugs all that good? Who can consume weight loss medicines? That's the big talking point on Health 360. Hello and welcome to a brand new episode of Health 360. Well, this week we decided to focus on something that has got the world talking about. Well, look around you. How many people are just so keen to lose weight? And in the pursuit of just that, so many people end up doing a lot of things. Some beneficial and safe, many risky and pretty worthless. Well, India's overweight population and obesity figures are pretty mind-boggling. Take a look. And that really is the reason why just so many people are getting obsessed with weight loss medications. Mounjaro from Eli Lilly has entered the Indian markets. But before that, Indians have somehow managed to get their hands on other anti-diabetes drugs like Ozempic. So what is the science behind this drug which is meant to deal with diabetes? Who can use anti-diabetes medicines that also seem to be aiding in weight loss and seemingly in a very effective way? How sustainable is that? What are the side effects? What are the side benefits? Our panel of experts, the best voices on the science of weight loss, are with us. But before we go into that detailed discussion and discuss that issue threadbare, a look at this report. These transformations have hit headlines. And the million-dollar question here is whether these are Ozempic transformations. Unlike Hollywood, which is vocal about the use of weight loss drugs, Desi celebrities have not spoken about it.
Some of the visuals you're seeing behind us are celebrities who've actually admitted to using the medicine. We have a whole lot of celebrities that we think may be using the medicine, but they're not talking about it. Why is this medicine seen as cheating? When we take statins or we take medicines for controlling diabetes, it's not seen as cheating.
Maybe one of the reasons could be they just want to pat their back that they have got the fantastic genes, and sometimes, people just want to say that my genetic pool is coming much more stronger.
But the fact is that weight loss medicines are supremely popular, and that is no secret. The market for the same in India has grown by leaps and bounds. Mounjaro, Eli Lilly's anti-diabetes drug that has entered the Indian market, is not exorbitantly priced. A complete dose a month would cost around 17,500 rupees. It contains the active ingredient tirzepatide. Ozempic, though officially has not entered the Indian market, is being used by affluent Indians who have managed to get their hands on them. It contains the active ingredient semaglutide. Weight loss drugs world over have transformed the business of weight loss, and how? Touted as game changers, these are fast changing the weight loss market in India as well. The market has seen rapid expansion, with sales figures rising from 137 crores in November 2020 to 535 crores in November 2024. It is undoubtedly directly proportional to the rise in obesity population in the country, from 25% in 2013 to 40% in 2023, highlighting the need for effective weight loss medications. Novo Nordisk's Rybelsus which is an oral semaglutide, has captured a significant portion of this market, accounting for 65 to 69% of the sales. The launch of Mounjaro as an anti-diabetes and off-label weight loss medicine has found favor as an affordable weight loss option. Novo Nordisk is also poised to launch its semaglutide injection, Wegovy, in India. The drug has also shown cardiovascular benefits in Indian patients. And joining us today are, like I said at the outset, our panel of best experts on the science of weight loss. Dr. Anoop Misra is a well-known endocrinologist, Fortis CD Hospital in Delhi. Ishi Khosla is a nutritionist. Priyanka Lahiri is a fitness coach of the PFC Club, and she's had her personal journey of weight loss, which is very inspiring. Dr. Rajiv Govil is a weight loss expert. Thank you all for your time here. And I want to begin by asking Dr. Anoop Misra, well, how really has the demand for this medicine that we're talking about, you know, Ozempic, now Mounjaro, increased over a period of time? I'm told that doctors like you have many queries with patients come in and say that, you know, ye to prescribe karna hi hai.
Obesity and diabetes has been increasing for the last 2 decades. The question was whether we have any effective weight loss medication or not. So till a couple of years back, we did not have anything. So this was, there is a demand, there is a whole market there, and these drugs have just fulfilling some of that market. Now, the effectiveness of these drugs is that they target both obesity as well as diabetes in a very effective manner.
Okay.
Also protect heart and kidney. So that way they are multifaceted drugs. So not only obesity, diabetes, heart disease, kidney disease, everything.
So would you say that you would give these to people who aren't diabetic but would want weight loss as well? Is it something that doctors would advise?
Yeah. So initially discovered for diabetes, but once the appreciable weight loss was seen with these patients, now they are FDA, the US authority, has clearly licensed it for people without diabetes, people who are just obese.
But not Mounjaro.
Both the semaglutide, which is Ozempic, as well as Mounjaro now.
Okay.
So both are now open. In fact, if you look at the Indian market, for the first time, Indian regulators have licensed these use for obesity itself.
Okay. And tell us, you know, who really needs these drugs? I mean, a lot of people who are not seemingly obese or maybe a little overweight are having these drugs, are consuming these drugs. They may not necessarily have diabetes. I don't want to name people here, but there are so many celebrities who could do with some weight management but are not necessarily diabetic. Would you say it is okay for them to take these medicines?
Not necessarily. There are guidelines. I mean, we have made the guidelines for India, and there are guidelines for the world. And the trials where Mounjaro or Ozempic has been used clearly have patients who are BMI is quite high. BMI
above 35?
Is no. 27.5 and 30 with diabetes or without diabetes, so which is fairly high BMI. So these patients have been tried in the trials. However, if some person has existing heart disease and has a BMI of 25, 26, so both the things together along with diabetes, it is worthwhile using these drugs because they will benefit heart as well.
Okay, so tomorrow, let me put it this way. If I were to gain weight in a way that I would require weight management, I would require to lose some kilos, but I'm not diabetic. Would you advise it to somebody like me?
If your BMI is not much, so I would probably not give you any of these drugs.
Okay.
However, if you gain weight over a period of time, and your BMI goes beyond 27, 28 or something like that.
Which is clinically obese, or is it just overweight?
Oh, clearly obese.
Clinically obese is when your BMI is above 27.5, 28.
In India, obesity is differently defined.
Okay.
And the BMI above 23 is defined as obesity.
Right.
But for use of these drugs, which are very powerful drugs and expensive too, in such cases, BMI has to be higher. So worldwide, the licensing of these use is for higher BMI, if only used for obesity.
Okay, if only you saw obesity. Ishi Khosla, a lot of information now, and it's available for us because we're just learning about these drugs, I think, is on the kind of impact it has. You know, many people may not want to talk about it, but serious nausea is what I know of a lot of people who've reported this. The fact that they don't feel hungry, and it's not a nice feeling not to feel hungry and feeling, you know, nauseous and vomitish all the time. It has a direct impact on the gut. What is your view of how this medicine is being used by just so many people now?
Yes, Sneha, the thing is that, let me just go back a little bit on the question of obesity itself. And clearly it's a complex issue. Had it been so simple, just calorie counting and food control would have cut it for us, would have done it. And we've had, for the last 3 decades, been counting calories through every possible means, and every packet that we eat and every, you know, it's all there. Today people are far more wiser about calorie counting, but that hasn't really yielded the results that we are looking for, and obesity is growing. And what this drug is really doing is it's cutting down the amount of food that you eat to a fraction. A patient of mine yesterday just called me and said, I'm eating only 10% of what I used to eat. But that's really low. And so if we are going to starve people to lose weight, I'm not sure whether it's a really safe or a sustainable way of looking at obesity. And till date, like Dr. Misra also said, there have been so many drugs that have come and gone, and their safety has been questioned. And so these are early days for these drugs for proving their safety. And I don't think it's a great idea to die of malnutrition with your weight in place. So I think we need to look at deeper dive into really what is causing obesity, and today we do have answers. And if you look at the gut, like you rightly said, it affects the gut. Obesity itself, to a large extent, is beginning in the gut, be it causing an inflammation or insulin resistance or malnutrition. All of these factors are contributing to obesity, and we have the tools to deal with them. And today, when you look at the gut, we look at the microbial flora, the microbiota. And if you have today the science around a good ratio of good and bad bacteria, we are able to tackle obesity to the extent that today fecal transplantation is a research tool. It's not really in clinical practice, but just fecal transplantation from an obese individual to a lean individual and vice versa changes the obese into lean and lean into obese. So that clearly tells you that a lot is happening in the gut. And if you're able to tackle that, that may be a far more sustainable and a more easy solution than to take medicines which reduce your food intake and at a price.
So you're clearly somebody who's saying that try the natural way first. You know, try it the longer route, maybe not a shortcut, but a safer and a better route.
Yes, because how long will you take a drug? And we know that we withdraw the drug and we get the same results.
And I understand that this drug has to be taken for a very long period. I mean, there are reports, and correct me if I'm wrong, Dr. Misra, that over a period of time, you can't even stop it, is what I understand.
No, not necessarily. If you lose 10 to 15 kg of weight, and a patient who was not able to walk a couple of steps is now running, you don't need the drug. And by reducing 15 kg of weight, you make the diabetes disappear, and many other diseases. For example, liver. Liver fat disappears. Liver fat is something which Indians are plagued with. It is a major problem for metabolism, even for heart disease. So it is not necessary that you have to take it for 1 year or 2 years. However, trials have been done for 74 weeks or maybe more, and which show marked weight loss, reversal of diabetes, reversal of fatty liver, and marked changes as far as heart is concerned in a better manner.
Okay, so which means that, you know, the outcome of weight loss would also mean that your overall metabolic health may just improve, and it improves, and that could be a good outcome of the drug. I'm just going to come back to you quickly to Priyanka Lahiri. Priyanka, you're a fitness coach yourself now. We've seen, you know, your social media with your own personal journey on how you lost that weight. First of all, tell us, as a fitness coach, do people come to you and say, make us exercise, make us work out, and also batao ki ye medicine khana hai ki nahi? Is that a common query? Are people asking you whether this medicine should be consumed or not? Priyanka.
Hi. So Sneha, when I coach people, I'm also making their diet charts. I'm also a sports nutritionist, so I'm taking care of their diet as well. Now, a lot of people do come to me who have very, very high weight, like the highest would have gone to 180 kgs. So they do ask me for supplements, they do ask me for some medicines, but I always tell them that you need to speak to your endocrinologist first, because firstly we are not ready to advise that to our clients.
Yes, of course.
And secondly, in weight loss we come into this space where like the endocrinologists say that first figure out lifestyle changes, first fix everything else, and if nothing works then the medicines should start. And this is where we come into the picture. So because a lot of people are not able to lose weight because of insulin resistance, and insulin resistance can be fixed with a lot of other ways like exercises, improvement of muscle mass. And a lot of people are able to do that, but a lot of people are not able to do that because of their high obesity, and because of that they are not able to move a lot. But they do ask us these questions, and we definitely shy away from answering those questions ourselves.
Okay, so that is a frequently asked question, is what Priyanka is saying. Dr. Govil, talk to us about, and because you're a weight loss expert, tell us about the potential misuse of these weight loss medicines that we are seeing. For people for cosmetic reasons to look a certain way are resorting to using these drugs. What would your advice be? Who should be taking this drug? First of all, actually answer who should not be taking this drug.
So the mood problem is that obesity is the mother of all communicable disorders, and obesity should be first considered as a disorder first. So these drugs, whether it's Mounjaro or semaglutide, are to be used by experts, number one. They are not for cosmetic weight loss. They are not for looking good in a marriage ceremony or in a photograph. It's for chronic weight management, and chronic weight management is done to prevent the progression of any comorbidity or to prevent any kind of comorbidity coming in. So misuse will always be there because you end up with 10 to 15% weight loss. That's why it has to be used by experts and endocrinologists and diabetologists who know about the whole pharmacotherapy and the whole physiology of how weight gain and weight loss comes in. Apparent misuse occurs globally, and that's how we need to make sure that we are able to limit the misuse of these drugs. So limiting the prescriptions to people who know about weight gain and weight loss will help the proper channeling of these prescriptions. Number two is that it should not be written by people who are not qualified to write prescriptions across the country. The misuse can be there because it works on the brain, it reduces the movement of the stomach. So we need to identify a lot of contraindications to the drug. Like every overweight patient cannot be on a pharmacotherapy for weight loss. We need to identify which patient fits the bill, which patient has got comorbidities or conditions related to obesity, and if we are able to cause any prevention of progression or getting them into normalcy, and then use the drug. And as Dr. Misra said, that 27 is the cutoff if you have a comorbidity, or 30 BMI is the cutoff if you do not have a comorbidity also. But it has to be managed by experts. That's extremely important.
Not over the counter. I'm seeing, Ishi Khosla, a lot of conversation, and because everything happens on social media nowadays, on a particular celebrity having an Ozempic face. I think your glow is just finished for a lot of people. So why does that happen in so many people?
That's
and it
what
doesn't happen in many people.
I told you, it's when you're going to cut down the food intake to a fraction of what you're supposed to be having, and also disturb the microbiome negatively, your nutritional quotient is really poor. Number one. Number two, it is known to cause sarcopenia and bone loss and dehydration. So I mean, these are really early days, but beyond that, of course, we know the other risks, you know, the pancreatitis risk. And in fact, you're talking about the glow, but I can talk about life-threatening complications.
Yes, absolutely.
I have a patient who was 18 years old and in a hospital under an endocrinologist, and in 2 weeks of initiation of the drug, died of acute pancreatitis. And
Of which drug was this? This was Ozempic?
yes.
Okay.
And this is, I mean, there are reported cases. There are supposed to be, according to one paper that I just recently read, almost 82 deaths with the use of these drugs in the last few months.
The serious side effects of it. So what should be kept in mind before, you know, taking these drugs? And talk to us about the other side effects like we're seeing in many patients, and it goes beyond nausea. Like you said, muscle loss is a big problem also.
Yes, sarcopenia, yes. And I mean, if you look at the celebs who are promoting it, they're also, I was reading a whole report on celebrities in Hollywood who have said they'll never touch the drug because they felt so sick while they were on the drug. So they'll never ever go back to it. So there are reports of people who have struggled with it. So yes, these are early days, and I think we need to also understand, maybe Dr. Misra would be able to be putting light on the fact that who is a candidate, who will get pancreatitis, who will not. So there may be some criteria where you can differentiate from one patient to the other. So yeah, I think the safety is one very big issue. And my biggest question here, Sneha, is why are we talking about weight loss? Is that the target? No. I can starve anybody and put you on a liquid diet or a you know, just all water diet and make you lose weight. We're talking about a lifestyle change and sustainable and safe weight loss. If those are our goals, you know, things need to be then evaluated differently.
Absolutely. You know, I think there's the obsession with looking a certain way, plus also the kgs, essentially the kilogram. I mean, I could be losing fat and gaining muscle. I could still be the same weight, is something that I think people tend to forget. Dr. Misra, what's your advice? I'd like to ask you, how would you like to warn people who are thinking about taking this drug? What would you tell them?
See, let me be very clear. These are not drugs to be played around. It's not something that patient can start themselves, and certainly without any indication, and not for cosmetic weight loss. So that's very certain. When we begin to put this drug on anybody, we counsel the patient properly. We take the history of pancreatitis, as Ishi has already said, but recently our own study has shown there is no high risk of pancreatitis. We take history of thyroid cancer in the family, because there are some studies in the mice and animals that it may increase thyroid cancer, but that has not been proven in the human being. But we always take a history. We always take a history of gut disorders. For example, somebody who already has a lot of nausea, vomiting, diarrhea due to some other cause is not going to tolerate this drug. Because 30% of the people will have nausea, vomiting, diarrhea, and some people will leave this drug.
Very important. If you have an underlying problem, then do not take it, is what Dr. Misra is underlining right here.
Absolutely. And long-standing diabetes, the intestine goes very, very slow. And what is called as, you know, autonomic neuropathy and gut stasis may occur in such people. So we always choose the patients very carefully and advise them that this may occur to you. Also prescribe them rescue medication. So, like I said, it's not a drug to play around with. It is not aspirin. It is not a simple paracetamol you can buy on the counter.
It's not a simple paracetamol. A quick word from Dr. Rajiv before we wrap. Dr. Rajiv, Dr. Misra said that the weight loss here is sustainable once you take this medicine, if you should be taking it. Please tell us, in your experience, how sustainable has that weight loss in that sense been? And should it be taken by people who are clinically obese, or not clinically obese but overweight and may not necessarily have a metabolic disorder like diabetes?
So the clinically obese patient should obviously take it. The overweight who do not have comorbidity will eventually have a comorbidity. Pharmacotherapy for obesity, like any other non-communicable disorder, one should consider it as chronic and lifelong. Because what data suggests is that once we withdraw this treatment, within a year 50% of patients have almost 50% weight regain. And so you will have reappearance of all those complications or comorbidities that you actually started off with.
Okay,
So
I just
the
want to just
therapy
quickly
for
ask you to just
obesity
be
is
with us for a
also
second.
lifelong.
Okay, Dr. Raji, because I'm running really out of time, and Dr. Ishi in fact has a point to make. Ishi, you were wanting to say something about how the weight comes back.
When the weight comes back, it comes back higher than what it started.
Dr.
That is
Misra?
because of muscle loss each time you lose weight, and that weight cycling is the dangerous trend.
Two issues.
Yeah.
One is how much weight comes back. The studies which show that it does any this thing, diet, exercise, this drug, weight always comes back. But in the studies, recent studies have shown that it does not come back to the same level as before. That is number one. Number two, sarcopenia is a problem in Indian population.
Yes.
And we always advise that you have, besides exercise, which you should never leave, you should also do weights and resistance exercise.
Priyanka, in fact, a quick word and a last word from Priyanka on that. Somebody who's lifted weights, and her videos are amazing. You should just check them out on how her transformation has been. Priyanka, a quick word, 30 seconds on the significance of lifting weights and exercise, no shortcuts.
Hi. So I have hypothyroidism, so I was taking metformin, and which was prescribed by the doctor. But ever since I started lifting weights, I started building muscle mass and also had a very active lifestyle. Because of which obviously my metabolism went up, and I was able to lose fat much faster, much later, but I'm able to maintain my weight now. And that's only because I continue exercising. I'm pretty sure if I stop doing that, it will all come back to me.
Well, absolutely. All right, Priyanka, we're really running out of time. I'm going to thank all of you for joining in and sharing your views with us on really what is the most talked about issue in our circles nowadays is weight loss medicines. Are they miracle drugs, or we have to take everything with a pinch of salt? What are the kind of precautions? We're telling you much about that on our website as well. That's indiatoday.in. You can also check out these stories on our social media platforms, YouTube, Instagram, Twitter, which is X, and of course Facebook. Thank you so much for joining in.